In this short lecture of cardiac tamponade, Beck's triangle or Beck's triad will be discussed, which consists of three components which determine the condition of the cardiac tamponade patient. The first component is the low blood pressure, which is due to a specific phenomena called pulsus paradoxis, which will be discussed later. The second component is the JVP. JVP stands for jugular venous pressure, which is the pressure occurring in the jugular vein in our neck region. Or JVP can also stand for jugular venous pulse, which is the graph showing the X and Y descent. In this specific condition, X descent will be sharp and Y descent will be lost, meaning there will be no Y descent in the graph. And the third condition is the heart sound. There will be muffled or soft heart sound on auscultation. And some things are not discussed in this lecture, which will be discussed in the upcoming episodes. Thanks for listening.